Hawk Jewelers, timeless jewelry for generations.
Good evening, everyone. Welcome to Fight Against COVID-19. I'm your host, Dr. Shefali Agarwal. Thank you for liking, sharing, and subscribing our show. Thank you for supporting our show because with this show, we are able to connect to many people who are either working behind the scene, like making masks, supporting small businesses, providing food to the healthcare workers, but also the healthcare workers who are in front line and who are working day and night to support the COVID patients, including nurses. Today, I have somebody very special who actually is a healthcare worker, a physician who has seen many, many patients and also got infected with COVID. He's a hero, and I really wanted to share with him his feeling and how he sees his patients. So, let me welcome Dr. Himanshu Pandya, past president of API QLI. Hi, Himanshu.
How are you, Dr. Shefali Agarwal? How are you?
I'm doing fine. Thank you, Dr. Himanshu. So, tell me a little bit about yourself before we actually start talking about your experience and COVID.
So, I am a primary care physician, mainly the hospitalist, working at the Northwell and Mount Sinai Health System in New York. We were at the epicenter of COVID-19 in New York, mainly in the Queens and border of Queens, Long Island. So initially, we have seen so many patients of COVID-19 because hospitals were getting full with this patient,
Yeah.
and also the offices.
So, Dr. Manchu, let me talk a little bit about, when you started, what New York was the epicenter. How did you feel? You got all these patients, and what was the scene at that time when it was just like at the highest peak?
So the problem that we have noticed that every other day in the hospital, mainly the North Shore University, Manhasset, LIJ Hospital, and Mount Sinai Queens, every other day they had to open the new unit for
Oh
COVID
my God.
patients. So we literally felt that if there is no actually limit, we will be running out of the ventilator and all the resources sooner.
So, how many patients would you see at that time? Like, ICU and on the floor, many patients. And how did you like manage that at that time?
So I was seeing close to 30 to 35 patients COVID
Oh
positive
my God.
every single day. And unfortunately, because of weekends, and our colleagues were facing same problem, so we all colleagues from the medical field decided that we would not take any day off and
Yeah.
we'll come
Wow.
every single day to the
Yeah.
hospital to
Yeah.
see those patients.
So, there was another, you worked so hard and unfortunate situation. You also got COVID. Tell me a little bit about your experience and how did that happen and what was the stay? And then I'm going to talk a little bit about how you felt.
So in the hospital, we were taking all the precaution. Luckily, we had all the equipments, including the gowns, N95, face mask. The problem is seeing patient in the office
Yeah.
because they did not have any typical symptoms when they came to the office. And I was
Hmm.
seeing patient till 21st of March in the
Oh, wow.
office
Hmm.
wearing personal protective equipment, but still it was not enough because our offices are not equipped with negative pressure room. And I'm thinking that seeing this many patients, probably I might have gotten infection from one of
One of
the
them.
person,
Yeah.
yeah, or patient, yes.
So, so how did you start getting symptoms? Like, how did you know that you may have that?
So my actually habit in the morning that I always have a breakfast before I
Yeah.
leave house, and this was like consistent since I was in medical school. So one day I was actually sitting at the dining table and I could not eat anything for breakfast, and
Okay.
I realized that why this is happening.
Right. I think Dr. Himanshu will be joining soon. He lost his connection.
Yeah, sorry.
No, that's okay. I think it's a network. So please go ahead. Tell me a little bit about the that you mentioned that you were trying to have breakfast.
Yes, so I was sitting on the breakfast table and I could not eat anything. So I thought that probably, I must be tired, did not sleep well. I would eat probably lunch, but I could not eat lunch. So
My God.
next day I realized that there is something wrong. I did not have fever. I did not have any breathing issue. But then I spoke to my fellow and the infection disease doctor, and I decided that I will continue. I realized that I might have COVID, but I said that let me just continue seeing the COVID positive patient. I would not see anybody else. Uh, it will gradually getting worse and worse, and I did not eat for 12 days.
Oh my God.
So up to 10 days, I went to the hospital. I saw the patient. Then one of the colleagues told me that you lost so much weight, you better rest it. And then I decided that, okay, let me just rest. I did COVID test at that time when I stayed home, and it came back positive. So by that time, I got the news that it was positive. I almost passed 14 days. The good thing I actually have done, looking at what I did during that time, I made a decision, no matter what, I'm going to walk half a mile a day, no matter what, how is my condition. The reason behind that, when we looked at that, the study from the flu and the past epidemic, that the people who are like more active, they had a less severe problems. And this was not like scientifically proven, but when we looked at that, so this is the main reason I was going for a walk. Slowly, I started eating fruit on day 14. And after a couple of days, I was getting slowly better. So I had to rest it for like 9 days, and I went back to work after that.
So when you had these symptoms, did you have like any severe symptoms, or mainly that you couldn't eat food, or what were the other things? You had any breathing issues, anything like that?
No, so luckily I did not have breathing issue, no issue related to my fever, but only problem that I had because of not eating, I had profound weakness. The weakness is like going from my bed to the bathroom was like it was a big struggle. But I was so determined in that one about walking and ambulation. I had decided no matter what, I'm going to walk.
So, Dr. Manshu, a lot of people talk about COVID patients, and you went through this whole difficult time. What was your feeling, at the time when you had COVID? How did you, it's a pandemic and people are scared of it, and of course you're a physician. But what was your feeling?
So I personally wanted to mentally prepare, even if I did not have the symptoms of a fever or breathing issues. So I spoke to my wife also, and I told her, I said, listen, anytime I have any breathing issue or anything, just simply call 911. And since I told them that, I just wanted them to be prepared. They were like a little scared. So even if middle of the night they were waking up, they used to come to my room just from outside to see that how I am or I'm okay or not. But I felt that I was so helpless because you are walking around every day and suddenly you are in the bed, and this was a really like a big problem for us to just staying in the bed and you could not do anything.
So how did you, your family's right there and they can be, how did you maintain that distance with the family and trying to protect them and trying to get, better too? It's very hard, right?
Yes. So they were wearing masks. I isolated myself in one room with the toilet, TV, everything was in that room. So I did not leave my room except when I was going for walking. I told my wife and my son that I'm going for a walk. So you please try to stay away from that route when I'm going, and then I will go. I will wear the mask. I'll try to keep the safe distance from everybody. And I had N95 and on top of that surgical mask. And I went for a walk, no discussion with anybody. And this is what we did that. But most of the time, except the walking, I stayed in the room.
Yeah. What were some of the struggles? Like, of course, did your family feel, were they nervous about, getting something, or they had, like, I'm trying to understand, like, how this must be really, really difficult.
So definitely because they were scared about this COVID. And unfortunately, anytime you actually watch the TV, we never had any good news about
Yeah,
COVID-19
exactly.
till now. So the problem, they had it like they were not mentally prepared. And the best thing that I did, I told her, please do not tell anybody that I'm positive. Because
Yes,
once
yes.
you start telling them, you will get all the story from everybody, and most of the time it's not good stories.
Yes.
So I told them, stay away from there. Do not discuss with anybody. If you call somebody or somebody calls you, just tell them everything is okay. And I think that worked out very well because, in our community, few of my friends were positive and everybody came to know. So next thing they know that as soon as they open the door, there is a food,
Yeah.
medicine, a lot of
Yeah.
stuff, fruits, everything is actually in the doorsteps.
Wow. Yeah. So, did your family feel that they should be tested, or they didn't have symptoms, so they were fine?
So because I wanted to make sure they are okay, because my son and my wife, so we tested them also. So
Of
we three
course.
had a test together, and then
Okay.
mine was positive and they were negative.
Wonderful. That's great news. How did you feel afterwards? Like after you recovered, that whole 14-day and then the 9-day, what was the feeling like, when you have something like that and you're hearing things that you can really fall sick very quickly. And every day must be like, oh, I hope I don't have those symptoms. I hope I don't have those symptoms. But then you pass that time. How did you feel after that, when that time period, when you can say the most risk period is over?
So I felt that one when I was getting my strength back.
Yeah.
I got almost 80% of the strength back within like 10 days of rest. But
Yeah.
remaining 15-20% took almost, I would say, 3 weeks, 2 to 3 weeks. Because how I knew, when I was taking the steps in the hospital, I knew that before I used to go 4 or 5 stairs without any problem. Now I realized that I can go only one or two, and I was getting a little tired. So this is something I noticed, that also the somehow the appetite, I had to wake up at 2 o'clock in the morning because I was getting
No.
hungry, and I could not understand. But then I spoke to several of my friends, and it was surprisingly everybody had same issue. Whoever actually lost their appetite initially,
Yeah.
they were getting more and more hunger.
So, in terms of any psychological thoughts or something like, of course that's physical. Anything that you felt like you were thinking at that time or after? What was the difference at the time and afterwards?
So first thing that I had a determination
Yeah.
just to make sure to protect myself.
Yeah.
And the way I thought that definitely you have to be spiritual. I
Yeah.
used to pray every day for, I would say, at least 15-20 minutes in the morning. Then I actually set the schedule for little walk here inside the house,
Yeah.
outside the house. Also, I was thinking about only one thing, that if I get the breathing issue, I'm going to end up in the hospital. So I was trying to take deep breathing, yoga, pranayam, slowly, slowly, just to make sure I can protect the lungs, and then not to go to the hospital.
That's, first of all, thank you for sharing such a emotional and difficult journey you went through. We really appreciate. I think people who are watching will be appreciate that. I know that you mentioned that while you were COVID positive, you still made a mission to treat patients for 14 days, although you were suffering yourself. Why did you do that, Dr. Himanshu?
Uh, the first thing I realized, staying at home and resting is not good uh, during this time. The second thing is that I realize also there are a lot of our colleagues, they were actually seeing more than what they can see every day, the
Yeah.
number of patients. The third thing is that I wanted to keep myself busy, staying patient. So that was the main thing. And fourth thing is that when you are sick, that staying at home, looking at the wall, sometimes it's not good idea versus
Yeah.
you keep yourself busy. And this is the
Yeah.
main reason I continued to work.
That's amazing. Salute to you and salute to all your colleagues. It's an honor to have you, people like you who are dedicated, although you're struggling and trying to deal with the situation yourself, but you're still taking care of the COVID patients. So tell me a little bit, let's change a little bit about, you see so many COVID patients. Tell me a little bit of how you see those patients. What do they feel, in your, and some of either their risk factors in New York, we saw a lot of trending saying that more Afro-American patients are getting, how do these patients feel overall?
So I have seen the various ages of the patient, and most of the time that the patient I have seen, including the physicians were my patient, uh, they told me when they were leaving home on the day of discharge, uh, two physicians told me clearly they felt first time if you are drowning, how you feel. And because of this, both were admitted with the breathing issues, the shortness of breath. The three patients in their 40s, they also told me that first time they felt the fear of death.
Oh, wow.
The few, when unfortunately the hospital had a policy that visitors cannot come.
Yeah.
So if I have to call somebody, family member, and explain to them that the person is not doing good, it was very critical for me also.
Yeah.
So there was a physician's family member, and I knew that she's not going to make it. So I told them that, I said, listen, I understand this is the outcome, but what can we do? What can I do? And then according to the family members, and they were like, some of the family members were out of the country, I did actually Zoom.
Yeah.
I got it. We did Zoom, and almost like 13 family members joined in that Zoom.
Wow.
They were able to see the patient like 2:30 in the afternoon. We had that Zoom. One of the family members were living in the New York, so I spoke to the case manager and the nurse manager and requested that at least we can allow them to come. So they were able to come at 5:30, and patient expired at 7:30. And so we had so many actually story about this, but
yeah, do you mind sharing one or two touching stories that really shook you and said, this is so different than anything else that I've ever seen?
yeah. So one time we had a patient who was like 45 years old. Patient was on dialysis. And when patient came, since that patient used to come to the hospital, but most of the time was dialysis related issues to get some elective surgeries, but not for any sickness. So that was his first sickness. I was talking to him, and then every day we noticed that he was not getting better. At that time, we had some trial. So I enrolled him in trial. He was able to get some medication, but slowly, he was deteriorating. So before I actually took off, when I'm not feeling good, so he was still in the hospital. So I went to see him, and I said that was Saturday, I remember, and from Sunday I took off for my sickness. So Saturday I was talking to him, and I said that, listen, from tomorrow I'm not coming. I need to rest, and I will see you, and we'll talk. So as usual discussion, I had it. So he actually told me, he said, Dr. Pandya, thank you so much for your help, and I truly appreciate, and I will pray for you. And I said that, you know that I need to pray for you because you need more help. I'm going home. At least I'm okay right now. I have weakness. I'm going to eat. And he said that, but probably I might not be able to see you.
Oh my
So
God.
when I was leaving, I stopped for 2 minutes. I came back. I spoke to him. I said that, tell me. He said that, I don't know. I have feeling that I will not be able to make it. And after 4 days, he expired.
Oh my God. Sorry. Yeah, so those are difficult stories, and many people. You told us that you almost saw 250 patients. So are you back to hospital now? Now that you've recovered, are you still seeing patients?
Yes, I'm still seeing patient, but right now we have only 3 COVID positive patients. Rest of the
So it's
patients
gone
are.
down. Yeah, it's gone down a lot. Yeah.
Yes.
So how do you feel when it started? There were so many patients, and it was so many patients dying, and today it's gone down. That peak of New York may be coming down. How does that feel, Dr. Pandya?
So I will tell you one thing, because when we were making rounds in the hospital, every 5 minutes we were listening that it's a rapid response or code blue for the cardiac arrest.
And what is code blue?
Code blue means somebody has a cardiac arrest, means somebody's heart stopped.
Okay.
And most of the time, those patients were.
I'm only asking for the viewers to know because they may not understand.
Sure.
Yeah.
No, sure. So somebody is in the hospital. If heart stops for any reason, the hospital usually calls code blue. So
Sure.
all the on-call team will know and they will run to that location because they announce the location like room 345, for
Mhm.
example.
So you were seeing that all the time at that time initially,
Yes,
and then I think you were saying something that you at that time we would walk and there were so many code blues. Has that changed now?
yes. Big difference. Big difference that we see. And not just that, the patients were going during that epidemic, the pandemic, patients were going on ventilator. And the problem with that, whoever went on ventilator, it was very difficult to wean them from
Yeah,
the ventilator.
yeah.
Yes.
So, New York got hit the most, and there were so many people. I mean, we are on the other side looking at the TV and the news, and really, you were the midst of that. How was the emotional feeling for people around you, physicians, healthcare workers, everybody who was dealing with people dying, like, with the short notice, like you said, going on ventilator and dying? How was the morale?
So it was a very difficult for families because I would tell you that one time we had a patient and the patient was talking to the family at 2 a.m. Everything was fine.
Yeah.
Next thing at 9 o'clock, I got phone call that he had a cardiac arrest.
Oh my God.
So it was a very difficult for family if somebody is talking to the patient, everything is going well at 2 a.m. and 9 a.m. you are getting this one. Just in 7 hours, things are changed.
Yeah. So, a lot of our viewers and others, people ask, they're scared of COVID. And, everybody is, I'm as well. What will, as a person who went through this and fought this and came the other side, what would be a message to these viewers, people who are, worried to come out and are scared with this pandemic?
Sure. So I would actually strongly suggest them the prevention is the only best thing they can do.
Yeah.
Second thing is getting COVID is just a life and death situation. It has a very unpredictable course in the hospital. We have seen patients doing fine and suddenly they are going on ventilator or suddenly they are getting cardiac arrest. So my strong recommendation, use the standard CDC guidelines that hand washing, use the mask, try to avoid the crowd. And one more thing is that it's just one mistake can probably lead the whole family members onto this COVID. And we had actually one incident in the New York. So three actually bread earners from one family died.
Oh my
One
God.
family, three bread earners. So
And they
all
were
the
all
males,
together. Yeah.
all the males died. They have in the family is all females.
Oh my God. So, and what gave you strength at that time when you had this, Dr. Pandya? What was your strength? I know you said, I'm going to get up, I am going to walk. What was that strength that told you, I'm going to fight this?
So I would tell you one thing: spirituality was the number one thing
Yeah.
because I was doing pray every day, 15-20 minutes, and somehow I was getting like energy from inside that no
Yeah.
matter what, I have to fight with this.
Yeah.
Second thing is that the determination that I had it from beginning, that no matter what, because uh, when I was seeing those patients, and once you are spending almost 10 hours a day with all COVID positive patients, I knew that I'm going to get it no matter what.
Yeah.
There is no exception. But
Yeah. So you knew already the risk.
yes, so I knew the risk, and I said that, I would leave it up to God.
That's amazing. First of all, it's really amazing for to bring people, selfless people like you, who are in the midst of all this. Salute to you, sir. Salute to all your colleagues who are there, who knew the risk of getting COVID, but you still went there every day because you believe that you need to take care of those patients in New York, especially. And then after you got it, and then you fought it, and then you recovered, and then went back to have those patients. I mean, you don't see that, and it's just really an honor to have you on the show.
Thank you so much, Dr. Agarwal. Thank you.
No, I really mean it from my team, from me. I don't have words to say. And sincerely, I really want to salute you because I think we all are involved in some way, but we are not directly involved. And you were directly involved in that. Um, I is there anything that touched you that really you want to say to the viewers before you go a message, and anything that you can share with them that personally that helped you through this, or something that you remember in those difficult times?
So when I was going to the hospital, I treated every single person as my family members.
Oh,
And one thing, since they were in the hospital, they were not able to see the family members. I realized that no matter what you do, just enjoy the life, uh, just stay positive, and take all the precaution to protect yourself. Because at the end of the day, you are the main person for the family, your family.
great, great, great saying. Thank you for being on our show. It was a pleasure. Again, salute to you. And please take care of yourself. And to my viewers, stay safe. Like Dr. Pandya said, practice social distancing, prevent, going out there without any social distancing and all the precautions needed. And good night, Dr. Pandya. Thank you for being on the show and sharing your story.
Good night. Thank you so much.
Thank
Thank
you.